Can you talk a little bit about how you're hoping to pivot some of the mechanisms that we developed as part of our collaboration for the LGBT Fund for working on coronavirus and supporting the LGBT community through that?
The first thing to recognize is two things, right? One is when there is a very challenging situation in any community, there is very quickly an othering happening, right? It's somebody brings the virus, somebody's responsible. It's usually people that we don't perceive to be part of us. So often it's migrants, or it's the LGBT community, or it is somebody that doesn't exactly look or act like me, right? And that happened very quickly once the epidemic became real or a threat in communities. So very quickly we found that those that were already very marginalized before they became even more marginalized. And then the unfortunate byproduct of the coronavirus, many countries had to put down very extensive legislation to kind of facilitate the lockdown and restrict people's movements. And we saw in several countries very quickly that legislation was being abused against communities that were already not popular communities. We had a situation in Uganda where a safe house for the LGBT community was raided, right? And it was one of the things that many of us got engaged in. We actually used our mechanism to support groups that were affected by that. So what we saw very quickly after the coronavirus became an issue in many of the communities where we work, we had triple the applications that we usually have for the Rapid Response Fund. We knew there was a real need. Extended the mechanism and said, okay, maybe what we need to do is to really use the mechanism to address HIV, human rights issues, the LGBT community, but within the context of COVID-19. And so we then extended it a little bit, because we realized there were other groups that were really affected. So we extended it also to people living with HIV, sex workers and drug users. But most importantly, we made it open and we tried to find more resources so that we could help people quickly. And partly because what's so great about the mechanism that we created with you is that it's so nimble and it's so fast, right? So it works with a commercial provider. Within just a few hours, you can get people help, and that is very good in an emergency situation. Even just from the time that we did that, we issued 80 grants, $350,000 in a very limited period of time. And I think, unfortunately, in some communities, we're only just in Africa seeing the virus now taking hold and being a real threat to people. But what we're already seeing is the impact, the secondary impact, the economic impact, the human rights impact. And I think this is going to stay with us for a while. We are very determined that we will try and help those communities in the weeks and months to come.
One of the things that I'm really hopeful about in terms of the work that we're going to do together for this next phase of funding in an environment of COVID-19 is trying to protect both tracks. So not losing the gains that we're making in terms of HIV and AIDS, but recognizing, as you say, that we have to accommodate this. We've just been through, obviously, the International AIDS Conference and in the media and so on, this sense that there's a competition between different types of priorities. And as a foundation, and I know you've been doing the same thing, you feel the need to keep reminding people that there are still 37 million people living with HIV in the world, and many of those 12 million plus don't have access to treatment and so are super vulnerable. So the opportunity to both provide the immediate emergency support that you're talking about, often life-saving support for people who are really threatened or vulnerable, and then at the same time find ways to do things that will mitigate against COVID and might actually last for the longer term. New strategies of how to do things for the longer term seems to me one silver lining out of a very bleak and challenging environment. What are you most excited about and most concerned about with this new partnership?
Well, like you say, I think what we are facing at the moment is a very unfortunate, almost competition between two pandemics. And it shouldn't be like that. Nobody should say it is either or. Both pandemics need to be addressed. The people that will be hardest hit by coronavirus in most countries will be those that are also very vulnerable to HIV infections or worse health outcomes, even if they know their status and they are on treatment. As Frontline AIDS and as the Elton AIDS Foundation and as others, we just need to keep the heat on to say to world leaders, you can't play off one against the other. You can't put the lives of one set of people at risk to save another set. In many instances, these are the same people that we need to address. So what we created at the beginning of the pandemic, we created a framework for ourselves. We called it Sustain, Adapt, Protect. Sustain the gains we have made in the HIV response, adapt our programming, such as a rapid response fund, and protect the human rights of those most affected. That is one of the things we really need to keep front and center of our mind as we're moving into that next phase. I think what I'm most excited about, and it's always weird to talk about excitement when you look at our database and you look at all the horrendous stories, right? But we know there is an opportunity. One opportunity is that, people are recognizing that a lot of what we all do is building community resilience and also tapping into a lot of community resilience. We always all are very amazed about how adaptable people are in communities and how they think of new things and adapt to the situations that they're facing. And we have seen that, right? There's lots of really innovative new things that people have done to provide services virtually or in mobile ways, or out of a sudden governments can prescribe ART, AIDS medication for 3 months at a time, and that wasn't possible before. Or out of a sudden we can have take-home methadone when apparently that wasn't possible before. So we need to tap into those good news stories, right? And we need to keep on saying to people, here is an opportunity, and we need to carry that forward. But also maybe it's an opportunity at a time when everybody is feeling a little bit more vulnerable and is recognizing their own vulnerability in this new pandemic, is to remind them about the people that are especially vulnerable and why they're vulnerable and why it is important to create environments. And like you were saying, the more long-term effects, the legal changes that need to happen, the changes around policy and law enforcement that will protect people and make people safe and able to participate in their communities and access services that are available to them. We need to just all be very, very focused on reminding people about what a threat HIV remains. We went to an AIDS conference and we heard that 1.7 million people got infected with HIV last year, and over 60% of those new infections are in those populations that we're talking about. People can't take their eyes off that. That's getting worse, right? We haven't really managed to reduce new HIV infections. So we know that the eventual outcome, if people take off their focus now of HIV, will be, we will say, a very different number for 2020 next year. It will not be a good number. So we really need to keep on having that focus and reminding people about why it's important to respond to HIV.
It's a sort of tried and tested saying that moments of great jeopardy and often destruction in the world also can bring forth some wonderful areas of innovation. And so I really feel like we need to hold on to that as we develop these mechanisms. And particularly what you say about communities. I think even in the UK and in Europe and other parts of the world, to see COVID become this very scary, ubiquitous thing, it's communities who reach in the first instance. They're the ones who check whether other people are okay. And so I think it's absolutely the right thing that's where we're placing our energy and our effort. You didn't say about the things that you're most worried about, which are part of which, of course, is the competing agendas. But I wonder whether there's other things that concern you.
So many things that the COVID response can learn from the HIV response. I think we are the one health response that has a really good track record about how to get communities to the table, to be decision makers, to put political pressure on for people to have access to medicines. All of those things, we've got lots that we can carry into the response to the new pandemic, but we are not done. So I don't want it to sound like, also we're done with the HIV response and now we carry these things into the COVID response. That's one. I'm very worried about resources. I think the economic recession that is coming everybody's way. We already see that many of our communities that we work with at country level, many communities rely on the informal sector. The informal sector is failing in many countries now because of lockdown and so on. And that's only going to get worse. And then obviously the overall funding environment for everybody is going to get worse because our our own governments, donor governments are facing an economic crisis. And so in all of that, there is going to be a competition around what is the most important thing to address. And so it's about creating new movements and new synergies and finding new allies amongst ourselves to really make the argument why you can respond to many things in one response. It is a worry that we will lose sight and track, and that is not about whether me or you or anybody here has got a job to respond to those issues. It is about people refuse to really see what the work that still needs to be done. We can lose 5 to 10 years of things that we have achieved, right? And I think that's our job, to keep on reminding people what we are not willing to let go of. So that is, at the moment, is my biggest worry, that people are literally moving on and saying, less resources, less political attention, let's move on and do something else.
In the same way that we must make sure it isn't competition between coronavirus and HIV or TB or malaria or some of these other big killers, we've also got to make sure that it isn't a competition between those who can most easily pay for the solutions to the coronavirus pandemic and those who can't, because there's a real danger that that could happen too. One of the things that's been interesting about this much broader discussion, which everyone who works in infectious diseases is familiar with, what's the R number, how many people are getting infected, what's the rate of infection, how does the pipeline work between people who've been put at risk and people who actually convert to get the disease, and what proportion gets sick, is being able to make this case about, you really can't leave anyone behind. We have to be conscious that we can't leave some of the most vulnerable people behind, because we won't solve the problem. It has to be a total solution.
Global solidarity is an important moral good, but it also makes sense from a public health point of view, from an economic point of view, from so many other perspectives. I don't want to overplay a mechanism like the Rapid Response Fund, but it is built on that. It is built on not leaving anybody behind. It is built on the need to show solidarity and support with those most marginalized and most vulnerable, but also that we need to support people to make structural changes, like you said. Many of our community programs will address both at the same time. When you test for HIV, you can also test for COVID. There are so many synergies that we can create in the future that, and that we know all best, because people in our communities have provided those services. And we know that those most marginalized will provide those services best, not a health facility where people might not come for fear of stigma and discrimination.
I also feel that, the whole Black Lives Matter movement, this whole upsurge of anti-racist sentiment and the crossover between people who are disadvantaged or discriminated against and people who are contracting coronavirus, there's a sort of renewed understanding that there are structural determinants. There are things that make people inherently more vulnerable. Some people have just been extremely marginalized in terms of their ability to support and look after themselves. And that's something that we have to do something about if we want the world to work differently. Is there a story from our work on the Rapid Response Fund or the deep engagement grants that we did together that comes to mind about something really, really positive and amazing that happened as a result of that funding mechanism, and that we can be aiming for in this next piece of work we're going to do together?
Some of the very positive things that happened are, quite high level. So the legal reform, or us supporting a grassroots activist who challenged successfully anti-homosexuality legislation in Trinidad and Tobago. And the last step of that process was funded with the Rapid Response Fund grant. There was a successful challenge to cross-dressing legislation in Guyana. Under the most recent work that we have done, providing people with simple things like a bicycle and a salary for somebody in Nairobi to provide services to 500 people that can't come to a clinic under lockdown. It's not a huge amount of money, but it makes all the difference. Providing PPE equipment to community groups who are providing clinical services for the LGBT community or the sex worker community is making a huge difference. In Uganda, during lockdown, the first thing that happened was a raid of a safe house for the LGBT community. Again, supporting a couple of local groups, to get access to people, to go to court even under lockdown, to get people out of jail, and the courts acknowledging that lockdown legislation was being used disproportionately against this particular group, and most recently even getting cost awarded by the courts in Uganda for the people who have done that work. And that should all give us hope, and we can't stop trying.
The two-track process of what we can do right now for people who are super vulnerable right now, and what we can change on a longer term, more structural basis, is very exciting blend. And the foundation is really delighted to be working with Frontline AIDS again on this. The message that comes out of it is we cannot give up. We need to keep making these small incremental changes. As you said, once we get people to see members of a community that they fear or don't understand or judge, once we get them to see them as people, it dissipates this ability to be able to judge and punish.
I think what we have managed to do, and we're learning a bit more about that, is really trying to work with each other's strength. Where does the Elton John AIDS Foundation have influence and can tap into decision makers, and where do we do that as a global partnership? That's where we need to take hope from, and a sense of that we can achieve a lot more in these partnerships. It's not just about providing resources, it's doing advocacy at different levels and doing that together, right? And that's what we've been excited about talking with you about, how we can do that, really using where our strength is with the strengths that you have as the Elton John AIDS Foundation. And we're really looking forward to doing more of that in the future.
Absolutely. Thanks so much for your time, Christine, and for talking about this today.